Good morning, all. Am I audible? Great. Good morning. We are starting our reading club with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our great master Samuel Hahnemann for this divine science. Seeking blessings from our Guru, Dr. Prafull Vijayakar, sirs, who made this divine science and bridges with the modern science to make homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakar. Friends, we are in the journey of reading Organon of Medicine's sixth editions, as well as we are reading the theory of acute in our reading club. So we will continue our journey of Organon of Medicines. Up till now, we have covered the theoretical part up to 70 aphorism, followed by the understanding of the disease, and then case taking, and followed by the understanding of the medicines. So right now we are reading the proving part of the medicinal substance. So We are going a little faster in this chapter because these are the chapter that Master Hanuman has instructed to prove the remedy in a different form and how to use that in that. So the aphorism number 123, each of these medicine must be taken in perfectly simple, unadulterated form. The indigenous plant in the form of freshly expressed juice mixed with a little alcohol to prevent it spoiling. Exotic vegetable substance, however, in the form of powder or a tincture prepared with the alcohol when they were in the fresh state, and afterward mingle with certain proportions of the water, salts, and gums, however, should be dissolved in the water just before being taken. If the plant can only be procured in its dry state, and if it is power has naturally weak, in that case, there may be use for the experiment in the infusion of it, made by cutting the herb into small pieces and pouring boiling water on it, so as to extract its medicinal part. Immediately after its preparation, it must be swallowed whilst warm, as all express vegetable juice and all aqueous infusion of the herb, without the addition of the spirit, pass rapidly into fermentations and decompositions, whereby all their medicinal property are lost. So, Master Haneman is telling about if we are using the plant, so how to take that plant into medicinal substance. So, this plant is to be add the alcohol or sometimes the water, and boiling water, and it is expressed to fresh juice, and that has to be taken into brewing. So, this is what the instruction by Master Hanuman. In aphorism number 124, for this experiments, every medicinal substance must be employed quite alone. So this is what another condition we had put, that do not mix two, three plants in one, or do not mix the minerals in one. So it has to be taken as alone and perfectly pure form, without the admixtures of any foreign substance and without taking anything else of a medicinal nature, and the same day. So if you are proving the remedy, then you must take only single alone part of that medicinal substance without taking any other medicinal substance along with that on the same day, and pure form, not the adulterated form, nor yet on a subsequent day, nor during all the time we wish to observe the effect of medicine. So this is what Master Haneman is giving instruction, that when you are doing the brewing of the medicines, then at the same time you are taking only one drug, no other medicinal substance or of a medical nature, something which is affecting the brewing of that. It has to not to be taken on the same day nor on the subsequent day. So up till now, what time you are trying to prove the remedy for 3 months, 6 months, or more than that. So on this time, you cannot take any other medicine. This is the instruction, the basic instruction. During all the time the experiment lasts, the diet must be strictly regulated. It should be as much as possible destitute of the spices, of a purely nutritious and a simple character, green vegetables, roots, and all salads and herb soup, which even when most carefully prepared possesses some disturbing medicinal qualities, should be avoided. The drinks are to be those usually partaken of as little stimulating as possible. So during the proving, diet must be very simple and pure nutrition, but to avoid some vegetable herbs and something. So it was given in the footnote that the young green peas, green French beans, boiled potatoes, and in all cases carrots are allowable as the least medicinal vegetable. But anything which is even having a herb property, it cannot be used during the program. And also, it was written that the drinks are to be those usually partaken of as little stimulating as possible. So, the subject of experiment must either be not in the habit of taking pure wine, brandy, coffee, or a tea, or he must have totally abstained for the considerable time previously from the use of these injurious beverages, some of which are stimulating and others have medicinal properties. So, during the proving, you should not take it as it is. So this is what the diet and regimen during the proving by Master Haniman. So we are continuing with the understanding of the theory of acutes. So up till now we have understood the golden rules of applications of theory of acute. And in this, we have understood the activity, thermal thrust, and PQRS and change disposition axis in this case. So, before going to the books, I must advise all of you to read again this book again and again so that you are well versed in acute cases. And one more thing that in this book, there is no questionnaires has been given that what question to be asked during the acute cases and how to assess the activity by just observing and everything. So I have prepared one of the word file for all of you so that you can have confirmatory questions that this question has to be asked or you have to observe in the case that person is dull and dull only the person is sleep overpowering a person having a mental anxiety or a person having a physical restlessness or a person having a verbal changes. So this has to be a very unique for all of you, and it help you to assess that the activity of the patient. Also, there is some confirmatory symptoms that is helping you to understand that the patient is chilly or hot, so that it is easy for a busy practitioner or neophytes that they can handle acutes with confidence. So this is what we are dealing with. So. Today, we are skipping the second part of the Materia Medica, but I must have give you an idea about the clinical part of this third part of this book. So, in this, the some of the helpful hints and the case is solved by Dr. Vijayakar sir. So, by looking into case and then we read the Materia Medica, then it is easy for all of us to understand the whole book. So that's why I just kept all for you that I must keep the second part of Materia Medica and then we will have the second part. So before going to second part, we will start with the third part because this helpful hint help you in your clinical practice, and that is the reason why I took it is prior to the Materia Medica. So starting with the other helpful hint. So there are times when certain presenting symptoms lead us to think of a particular group of remedies. These presenting symptoms form a strong basis of prescriptions, of course, by equating the generals and thermals with that of the patient. So many a time we can think. So according to the history of the patient, we can get certain clues, and that clues help us to prescribe a certain remedy. So, for example, if in an acute state the patient comes with the excessive thirst for a cold water, when the patient comes to you in acute fever or something having a diarrhea or something having a throat infections, and the patient is saying that I need more water, and that is of a cold water, and if the patient is chilly, you must directly think of this of the remedy that aconite, Eupatorium percolatum, phosphorus, calcarea, veratrum, alb. As we all know that veratrum loves the ice and cold things, phosphorus loves the ice cream and cold thing, calcarea also loves the cold thing, even though in calcarea it is aggravated. Even Eupatorium perfoliatum is one of the remedy that is required for the icy cold things. And if you think that chili and angry remedy, that Nux vomica, chamomilla, colocynth, and hepar sulfur, they also require the excessive thirst for cold water in acute state. And when you think of the hot remedy, the remedy must be natrum, bryonia, sulfur, mug salt, and tuberculinum. These all are the remedy requires the excessive thirst for the cold water. If in acute condition the patient says no desire to drink at all, no desire to drink at all, no thirst, even in spite of having high fever and patient says there is no thirst, this is what clinical hint by sir that sir directly prescribe ask two questions regarding these three remedies and prescribe one of them. So most of time I must have experience of when the patient says there is a no thirst and there is a dryness of the tongue and mouth and patient is very, very mild, I generally prescribe pulsatilla in acute conditions. So this is what very clinical hint for all of you. If it is associated with the urinary complaints and the patient seems to be mild, but inside there is the angriness, you can think of a epis. And in bryonia is mostly a dry subject, so there is no emotions and there is a frowning and aorta in acute conditions. So you can think of this no desire to drink at all in acute pulsatilla, epis, and bryonia. So these are the very handy clinical health tips. If the patient having sips of water, thirst for sips of water, we must have understanding that the arsenic is one of the remedy that is a desire for the sips of water. So if we have a chili remedy with the desire for the thirst for the sips of water, the arsenic and tintard, natrum, ars, colocins, and china. Whereas in hot patient, if you have the sips of water, that it can be pulsatilla and sulfur. Again, to confirm the sulfur, I generally use to check the palm of the patient, and in acute condition, the palm of the patient is so much so hot. This is what the confirmatory point of the sulfurs. So mind well, there is a two different kind of picture. That is in acute, there is a different picture, and in a chronic also there is a different picture. So you have to keep in mind that these are the pictures we are dealing with in the acute pictures of that particular remedy. If the person comes to you with a thirst for the warm or a hot drink during the acute conditions, then you can think of a lycopodium. It is a carcinosin and the Eupatorium perfoliatum. So Eupatorium perfoliatum has desire for the icy cold drink as well as the warm drink. So whenever you can think of these two things are there, then you can think of again there is a severe bone pain, back pain associated with fever. You can think of Eupatorium perfoliatum. As we all know that Eupatorium perfoliatum is a great remedy for the dengue-like fever. So whenever you have acute conditions and it might be of a dengue or a viral fever, with this clinical indications of icy cold drinks as well as the warm drinks, then you can think of Cupidodium perfluatum. Most of time you can accompany this symptoms that the nausea accompanying with the fever. So whenever the nausea comes, the one symptom, one remedy comes into your mind, that is the epicar. Okay, but one should think of netramure is one of the first remedy in acute conditions when the nausea is accompanied with the fever. Other remedy in differential diagnosis are the Ipecac, arsenic, plutonium, phosphorus, bryonia, and sepia. Out of this, we can think of that netramure and bryonia are the hot remedy. The rest all are the chill remedy. So if you have a nausea and vomiting, nausea accompanied with the fever, and a hot remedy, you must have to differentiate from the netramure and bryonia. Or if it is a chili remedy, then you can think of the arsenic, ipecac, Eupatorium, phosphorus, and sepia. Another that there is excessive vomiting accompanied with the chief complaint. The first and foremost things that is the netramure is one of the indicated. Again, you go back to the above line that it is netramure, Eupatorium, antimtard, and ipecac. These are the four remedies. First, you can think of in excessive vomiting accompanied with the chief complaint. So these all are the anti-emetic remedy for all of us. So veratrum halb has vomiting and diarrhea. Everything is profuse. Oculus has also same the vomiting. Sina chamomilla has vomiting along with the irritability. Lycopodium has vomiting, which is relieved by the drinking of the warm food. Arsenic also having the vomiting, which is relieved by the drinking of the warm food. Faram is also a vomit. So this is what you can have a handy tips. If you have a patient having a fever with headache at vertex, specifically headache, the graphite should be first ruled out. So graphite is never have the headache on the vertex. So this is what you have ruled out. So patient removing cover from some time for some time and taking cover back again alternately with the perspirations, weakness, and yet a strong mental state is the remedy is camphor. So this is very important when you visit the patient in acute conditions, and during the visit patient is taking cover and suddenly patient feels I have a heat, and then throw up the cover, and after throwing up the cover patient feels there is a chilliness and then again take the cover. So this is what the changeability of something, and in that case and there is a perspirations and a weakness, you can think of the remedy is camphor. Again, children who insist on going to school in spite of having a high fever and insist on studying and doing homework in spite of high fever, not because of the fear of scolding or a punishment, but having a desire to learn that. Okay, and in normal conditions they tend to neglect and should get one of the good boy remedy, so they become good boy during the acute fever. So the remedy can be aurum, iodum, aurum mat, silicia, ignatia, taffy, and lycopodium, and you have to match the generals and the thermals of these remedies. Many a time you came across that the children who comes to your clinic, they become more friendly with the doctors but become panicky and do not allow the doctor to touch or examine required. So were friendly with the doctor, but when they come in acute conditions, they do not allow to touch or they become panicky. So then the remedy changed to the aconite, puja, stramonium, mostly the stramonium having the panic state, the lycopodium having the timidity, the arsenic having the insecurity and anxiety, ambragesia having the embarrassment, Paraita did not understand the Ipecac having the anger, vexation, frowning, and Timtat is so much a touchy remedy. So in that case, you can think of then the initially in a chronic condition, they are so friendly with the doctor, but when the acute state comes, they become so much so panic. So in acute state, you can think of these are the remedies. Now, point to note that some drug can be both thirsty and thirstless, so we can have many remedies in our materia medica in acute conditions. They can be both thirsty and thirstless. So, say for example, arsenic, antidote, china, pulsatilla, belladonna, and silicia. Sometimes you can think of the thirsty in the chronic and thirstless during the acute illness. So there are remedies which are thirsty in a chronic condition, but thirstless during the acute state. So Sina can be thirstless, Kalikap can be thirstless, but generally Kalikap is a thirsty remedy. Lacasis is also a thirsty remedy, but in acute conditions they become thirstless. We know the Brownia desire for the large quantity of the cold water at long interval, but it is what a thirsty remedy. But when they present to us in acute condition, they become thirstless. Sulfur is a thirsty, but in acute it is a thirstless. Same way the calendula, bella, and barita cap. Some remedies are thirstless in a chronic and thirsty in a acute. So we know that ipecac is a thirstless remedy, but in acute condition it is presented with the thirsty. Apis is also as thirstless, but in acute they might be thirsty. Pulsatilla having the thirst for the sips of water. Empty tart has also thirst for the sips of water, and China. Again, when the patient does not like to be questioned and about how you are feeling or what you are like to eat or drink, especially by his wife, or why you did not take your medicine today, or if he is asked the same questions twice and he expresses irritations by frown and not answering, the remedy you can think of is called as aorta, angry when obliged to answer. So these are the rubric, and in that we have 7 8 remedies that Nux vomica, acid phos, arnica, arsen, polosi. And the hot remedy, there is a pulsatilla, natremur, and another one is added by Dr. Vijayakar sir is the brand. This is the rubric for aorta. So to confirm the aorta, you need to observe the patients and you are asking the questions, or even the parents or even wife asking the husband that why are you not taking the medicines, and husband got angry on the wife, or they if they are asking twice the questions and the expressions of the irritations is found on in the form of frown or irritations and not liking to answer or a morose kind of personality, you can think of aorta. So most of time in acute conditions, aorta is the great entry point to prescribe. Again, some of the helpful hints by Vijayakar sir that in most of conditions that all kalis and silicas, we know that there is an anxious remedy. But when the acute conditions occurs, the anxiety disappear during the fevers and illness. So in acute conditions, all Kalis and Silica are less anxious except the Kali Kap. We know that Kaliyas along with the other Kalis except Kalikas are more anxious. 3 marks have anxiety of health, but anxiety disappear during the fever. So this is what we have to think of. Lyco has a 3 mark anxiety about health disappear during the fever. Even nitric acid has anxiety about health disappearing during the fever. Silicia has anxiety about health disappearing during the fever. And we know that Barretta carb and Barretta self have hardly any anxiety about health, but in acute conditions, they comes with a tremendous anxiety during the fever. So this is what you have to think of in a vice versa. The acute picture of the remedy is changing. So Barretta carb and Barretta sulf, they are more concerned about their acute illnesses. So they do not understand what is the gravity of the major complaint and the acute conditions. So in acute fever, they become more anxious, whereas in chronic conditions, they are hardly anxious about their health. Similarly, Sina, tuberculinum, ipecac have no anxiety about health, but increased anxiety during the illness or the fever. So Natrum has less anxiety about health during both. So aversion to consolation, we know that Natrum does not like a PT and the consolations, and even Natrum does not like a visitor in the room. Okay, so this is what Natrum has not so much anxiety about the health. Argentum nitricum, we know that the remedy for the anxiety and the panic. So anxiety in general, but no anxiety of health and no anxiety of fever during acute state. There is a silent anxiety of health where the patient is just looking steadily and indifferent, which is the sepia. So even though the sepia become indifferent as a reaction in each and every conditions when the sepia goes into acute state. So these are the few hints which is helpful in our clinical practice in acute conditions. Another point that the easy way to remember the thirsty and thirstless remedy. So, sir has made this easy understanding for all of us that we can remember certain remedies are thirsty and certain remedies are thirstless. So we all know that all carbons and carbonates are the thirsty. So we have a carbonates, carbonymales, carbon salt, carbolic acid, graphite, creosote, petroleum. And some carbonates like calcarea carb, kali carb, mac carb, natrum carb, ammonium carb, so all are thirsty remedies. Most of the polycrest remedies are thirsty, like from sulfur, natrum, wood, phosphorus, arsenic, china, opium, silica, veratrum, sicalcor, rustox, and stramon. Most of the angry remedies are thirsty, Naxonica, Colossal, Hepar, Chamomilla, and Aconite. Most varietas are thirsty, most calcareas are thirsty, except calcarea phos, which can be thirstless or thirsty both. Mercury are thirsty except Mercor and Merc IR, which can be thirstless also. So Mercury can be in a both thirsty and thirstless. But whenever you are dealing with the acute conditions, so whenever the Merc is thirsty, you prescribe Mercsol, and Merc is thirstless, you prescribe Mercor in acute conditions. So most Kalis are thirsty except Kali Carb, Kali Phos, which can be thirstless also. All the natrums are thirsty. Magnesiums are thirsty, but to a lesser degree than the natrum. Snake remedies are thirsty. All spiders are thirsty except tarantula, which can be thirstless also. Most of the metals are thirstless except cuprum mat and plumbum mat. So this exception has to be remembered in your clinical practice. So whenever the acute conditions comes to you, you can prescribe on the basis of this name. Most of the acids are the thirstless, but they desire a juicy and refreshing fix because the common theme of the acid is weakness and exhaustion, and the ATP depletion is so much so fast, so they require more energy drinks like refreshing juicy things and everything. So this is what you can think of. Acids are thirstless, but require juicy things. The polycrest remedy, which are thirstless, are the Pulsatilla, Lyco, ammonium mute, China, Gelsemium, Sepia, Apis, Antidote, Manus mostrata, Tarantula, and Thalicap. So we can have a conclusion at the end that Tarantula and Thalicap and China can be both thirsty and thirstless. So another point, what Sir used to crack the acute cases with this use of the acute chart. So we are dealing with the acute cases. So by looking into this case and understanding how to analyze the case with the easy way. So this was the case of Sir's cases, the case of the 6 years old child. Fever since 2 days. X-ray shows right-sided mid-zone pneumonic consolidations on second 18 Feb. Fever 103 degrees. The child was quiet, sleep was less, wanted to open his books and read during fever. So this is what we, by looking into this, you can think of how the child is. Did not trouble the mother. Mother had brought the child with the blanket wrap around with the warm sweater inside. All this did not disturb or discomfort the child, indicating he was chilly at that stage. So this is what the observation also. No thirst at all. One thing which was peculiar was that this mild, quiet child would hit his father, but very slowly. He was, though angry with the father, but friendly to all in the clinic. So, this is what the observations and the short history of the case. So by looking into the short history, what should be the things? First, we have to analyze the conditions of the patient. The child was become a very quiet and not so much so sleepy, but it is a dull. So activity has been reduced to dullness. Then we have understanding that the child is wrapped in the cover, so that there is a chilliness and there is no much desire for the thirst not at all, no thirst at all. So this is the thirstless. So we have a group of remedy comes in the dull, chilly, and thirstless. But when we looking into this dull, chilly, and thirstless remedy, one thing we have seen that wanted to open his book and read during the fever. So this shows that there is a diligence. So when we look at the chart, dull, chilly, thirstless, so we have a Gelsemium, Sepia, Sipos, Ignatius, Coffee, Natrum, Kabi, Peacock, and China. Out of this, we need to remember that the diligent remedies are acid phos, ignatia, steffi, and natrum cap. Now, by asking a certain questions in acute conditions to rule out one or two remedies that the refreshing brings no desire for refreshing these, rule out the acid phos, we have left with the ignatia, staph, and natrum cap. There is aversion to visitors or the public, but he is very good with friendly with in the clinic. So there is a misanthropy is not there. So natrum carb has been ruled out because natrum carb is not so friendly. And now we have the two remedy left with the ignitia and the staphy. So ignitia and staphy coming up means the child had some mental cause for the fever. Either the child was insulted or hurt. So direct confirmatory questions has to be asked. Was asked what had occurred before the fever? So this was the question by the sir. So the answer confirmed the drug that the child had been scolded by the father for not keeping things in the proper place. After which the child was not angry but hurt and he went into brooding without giving any expressions after which he got the fever. So this is what the hurt gives rise to the if here the anger is there and anger is not expressed, then another thing from this category, the anger suppressed, and but the reaction has been changed. But here he has hurt and he is not get angry on and went into brooding. So this brooding is one of the reactions of the ignition. So he was given Ignatia single dose was given, and the second day the fever increased at night 18 cough increased at night 18 also. The fever came to normal on the 19th morning. The appetite improved, thirst increased, child started playing around and cycling. On 27th of Feb, the X-ray shows the complete regressions of the lung pathology. Here, in this case, the things to be noted are the scalding was an action. So, many a time in acute conditions, the ailments are there, but we have to also considering the reactions of the patient because reactions gives us the idea that how the person is. But ailments are there, so there are sensitivity to many persons, but the reactions according to the patient. So here the scolding is an reaction or something which we called as the ailment. But what was the reaction? The staff reaction would be have been a giving vent to his anger in some way or other. So he might be kicking, throwing things, or showing anger on other people whom he knows will cause him no harm. For example, his mother. This is what a Stephesagria picture, but in Ignatia, being a more cultured and intellectual constitutions, brewed as a reaction feels bad, hurt, and brewed with staff does not. So the Ignatia was selected over the Stephesagria. This subtle difference in reactions gives us the right simillimum as desired result. So by looking into case, we can understand that how the reactions differ and that reactions differ the remedy also. So another case, a girl aged 10 years with a high fever since 5 days, coughing day and night, and the fever not responding to the antibiotic, another allopathic line of treatment. She had come to Sir after a gap of 2 years. The mother said after we treated her last for a recurrent cough and cold and asthmatic bronchitis, she was just fine for 2 years and she could eat and drink cold drinks and any trash, but she never really fell ill. Therefore, when the doctor could not cure her with antibiotic, I thought of coming to you, especially since he said she has to be x-rayed. So this was the case. So I look up her registered case and found that she had responded excellently to the dose of pulsatilla 2 years back. So we have a handy remedy that is a tonic remedy. So we need to understand that in acute condition, it must have to be in relation to this. Okay. So the observations, I look at the girl who did not look sick, sitting calm, quietly on a chair. As I told her to lie on the examined bed, she got up promptly and followed the orders. Mother said, yes, she is not worried about her fever. Stop. She is more worried about me. She says she wants to help me, even for water which she is drinking a lot, she get up on her own and drink so that I do not get trouble. So this is what very important. She feels cold and lies with the blanket. So here the chilliness is there. So got the X-ray chest done and the blood CBC done. The X-ray shows the left-sided pneumonia and WBC count was 18,000. So in above case, I perceive that she had first of all shifted from pulsatilla, which had cured her of asthma. She was no more hot or anxious weeping pulsatilla type right now, but we become very what we call self-sufficient. So fever had not changed her activity. She was neither dull nor anxious. She was chilly, thirsty. Above all, she was a good girl and obedient and caring towards the mother. So, in relation to the pulsatilla, we can think of the remedy that is a silica. So, the good girl type, the silica, which has no change of activity, thirstless, and chilly, was prescribed 1 dose. So, here when you go to the chart of activity and there is a no change, at that time we can think of a three remedy that is a opium, natramur, and a silica. And also there is a in newer chart it was a magnesium group is added in that. But here the you can look at that the not worried about the fever and having the taking care of the mothers and good girl image is there. So on the basis of previous prescription sir has prescribed the silica to that girl. So fever rose to 103 degrees same night. The next day fever was gone, no cough and lethargy was observed. The X-ray just shows clearing and complete regulations of the lung on the fourth day, as we have seen the cases. And the WBC count came down to 9,000 on the fifth day. So we have also seen yesterday we have seen the case of urinary tract infections. So it was a 13,200 WBC count, and on the fourth day it was a 9,000. So same thing happened in cases. The another case of the sir that the fever in the child 3 years of the age. Child wanted to carry it continuously, wanted to go out of the house where he was comfortable. If kept down, would constantly hold mother's hand. If mother went away, he would cry and force her up to came back. Thirst, thirst. The child had was for the cold water, but he would sips and even force the mother to sip. If she would not, she would start crying. He did not wear any covering on him. The case was studied thus. So this is what the case. By looking into this, what remedy comes into your mind? So activity increase, the mental anxiety is there. That means that weeping and crying. The person is what did not like covering. So hot, the cellular sulfur and apis, and there is a thirst for the cold water, but actually the sheeps. So actually the thirstless, but the sheeps often wants mother also. So on the basis of that, anxious plus what plus thirstless wants mother's hand and wants consolations and better in open air. The remedy comes is pulsatility. So HB was 9.3, total count was 28,000, neutrophil was 26. The allopathic doctor frightened the parent that the child might go into leukemia. So on the next day, the child was playful, fever gone, no medicine, child was completely okay. On the third day, report shows that HP was 9.3, total count was reducing to 19,000, neutrophil reducing to 64. On 25th, the child reported fine. Blood report shows the HP was increasing 10.8. Total count was 8,700 and neutrophil is 60. So by single dose within the 10 days or 12 days, all the septic conditions or the fever has been gone. So this is and again along with the rise in the HP. So this is what the indication that the right remedy is there. Another case, a case of acute otitis media. So 8-year-old girl complained of acute pain in the right ear. Since the pain had started, she became listless and was not moving about. Was just lying down, covering herself with a blanket. She was not interested in drinking, eating, or even television program. So by looking into this history, we have a dull, chilly, and thirstless. So we have a sepia, acid phos, Indonesia, Steffi, Netramka, Typica, China. So out of this, all the diligent remedies are ruled out, and indolent remedy has to be taken into consideration. So this does not even like drinking, eating, or not watching the television, which is the most for the children. So this is what that indifferent to the pleasures, indifferent to everything, plus indolent is the sepia. So one dose of sepia, 200 cure her pain forever. So this is what the acute conditions is. Another case of typhoid. So girl aged 16 years suffering from the typhoid, having the serum Vidal positive, serum typhoid titer is about 350 unit, presented with the history of fevers in 6 days, not responding to antibiotic. She presented as a silent, quiet girl, more or less sullen looking, answering my questions with a constant frown. The mother told me that since she is unwell, she is being sitting in her room and only wanting me to be in the room as a company. She hates me or anybody questioning her about her illness. So this is what you directly from this symptoms you can directly go to the remedy. She would love to be under the fan constantly, even when the fever was high. She loved only to drink cold water and was aversion to eating foods or reading books. So here the diligence is not there. She was hot, she was thirsty, and she does not like company of the room. So here the presentation says dull, hot, and thirsty, plus aversion to visitors, irritated when obliged to answer, and want loneliness but want one person in the room, especially mother. So she was given Natramune 200 single dose. The fever was gone the next day. She started going out on the third day to her college. Vidal titer high or not, the present resumed. Patient respond normal activity within 24 to 48 hours is the homeopathic dose, the minimum. So here it is very important to understand that the energy, see, the parameter of the homeopathic follow-up is different than the parameter of the allopathic follow-up. So the energy has to be regained after the medicine. That is one of the indications that patient is curing himself. Another case of the urinary tract infections plus jaundice plus bronchitis. A Parsi child, aged 2 years, was brought to sir crying continuously with the urine first cell count 40 to 60. Serum bilirubin was 1.7 milligram and the chest severely congested. So there are the three the diseases are there in these patients, and the three systems are affected. The child was constantly crying and wanting to be carried. I saw the mother trying to distract the child by showing her electric switches. The child would keep quiet for some time, seeing the switches, and cry again. It was having intolerance of pain, drank no water, and the face had a reddish discolorations around the mouth. When I heard the child cry, it was a piteous and a nagging one. The anxious, cranky, chilly, fussless axis made me ask her confirmative questions of whether she bores into nose, and the mother replied that yes, her hand was to be pulled away from her nose again and again. So here, the chilly, thirsty, cranky child, anxious child, and boring into nose, the indications was the Sina, and the Sina 200 one dose was given. The next day, the mother reported that the child asked for the food after 4 days, was less cranky, and played for a little while alone. But the pus cell had risen to 80 to 90 HPF and cough was more. But because pus cells are particular and both are aggravated, where are the generals of appetite was reducing, playing away from the mother was a general improvement. So I waited with the placebo. So this is what Sir's understanding. The fourth day, the fever had gone. On the second day, the pulse cell 0 to 5, serum bilirubin came to 1.1. The child was transformed into playful, cheerful, independent, and naughty child. The chest X-ray came clear on the sixth day. Here, the Sina work as an antibiotic, anti-jaundice, and B complex all in one, and all this is in single dose. So this is what. So whenever this comes to us, we always have mistaken to prescribe here. So we have to look into it. So if we have idea that the general has been improved because our parameters of general is most important than the particular. So we have to wait and watch for a. This is what the indications this case is giving us. So sir has waited, and within the fourth day, the pulse cell came from 80 to 90, become 0 to 5, bilirubin from 1.7 to 1.1, and the fever had gone. Child became cheerful, playful, independent, and naughty. And also in bronchitis, X-ray changes of bronchitis has been normal. So this is what very important to understand the follow-up in acute cases because of the parameters. We have to assess the parameters according to our homeopathic parameter, not according to the allopathic parameters. Another case, the case of the acute headache after a diarrhea. So lady aged 35 years complaining of the severe headache rang me up for the help. The headache is torturing me. She said, please cure me, but without asking me your whole set of questions. I can't come to your clinic because I can't sit, and there in chilled atmosphere for 2 hours. I know you will ask me my thirst. I will like drinking a lot of water. Most of the history which I required she had given me. I said just one thing. One thing. Tell me whether you had quarrel with someone just before this headache. She says no was the answer. I will now tell you something. I'm sure you have taken some antibiotic for something about 5 days back, yes, for the diarrhea, she said. So this is what sir is just thinking of Nux vomica. So I knew the Nux vomica was the remedy. So the axis is mentally anxious, chilly, and thirsty, and angry when obliged to answer. So she was either Bella, Nux vomica, arsenic, China from the rubric number 1. And she required arsenic, Nux vomica, acid, phospholucins, arnica, angry when obliged to answer. So chilly and a large quantity of water means she is Nux vomica and colossus. If there is a quarrel, and she suppressed the anger, the remedy could be colossus. And if there is no quarrel and she took the remedy, she took the antibiotic for a few days back, then the remedy is Lux vomica. So here, this is what very important. Sir has just ruled out it by looking into chart. So there was no element from anger, quarrel, vexation, etc. Hence, the colossus was ruled out, and only Lux vomica is coming up. Hence, the last question is antibiotic. So she was advised a dose of Naxonica 200, after which she should expect transient loose motion for a days as headache goes down. And she reported on the third day saying, I am fine, all that you predicted came true. So that is what things is. Toxin has transferred from endoderm to the mesodermal connective tissues and the headache has started. So this is what you have been reverse it by bringing the toxin back down to the diarrhea and everything has been normal. So this is what you predict the patient and the patient will tell you that it happened according to you told it. Another case, the case of a child with the bronchitis, a child of 2 years with the bronchitis starting after some work of the repair started at home. The child was cranky, wanted to be carried, wrapped up cozily in a blanket, with the mother carrying a bottle of water which he would drink in between crying spell. So here, the cranky means the irritability, the mental activity is increasing. So this is what the mentally anxious, plus chilly, and thirst for the little water often. So here, this is understanding that this gives you a clear indications of the arsenic alb according to the chart. So arsenic alb was given. The only other drug indicated is anxious, chilly, thirsty was Sina, which was ruled out because there was no rubbing or boring of the nose. So this is what very important, the difference between arsenic and Sina in acute conditions when the both are cranky, irritable, and anxious. The another case of 11 years old girl with the hyperpyrexia of 105 Fahrenheit. She could not come to the clinic obviously because of the excessive weakness with the fever only of one day duration. So in one day she got a very great weakness. The mother said she just covered up and was sleeping since afternoon. She did not even get up to take tea or water. She is sweating like a hell. Please come and see her. I said I can't come at least up to 11:30 p.m. I will come and see her only after I have finished seeing all the patients. But in the meanwhile, give this single dose to her and let me know within 2 hours from now. So it was 6:30 p.m. Then at 9 p.m. to my surprise, the girl herself walked in saying, "Thank you, uncle. I am fine. I just came to thank you and tell you don't take me the trouble of coming for the visit." So this is what the things is you have to such results turn not only the patient, the allopathic world, but also the homeopath themselves. The remedy was worked out on the following point. So here looking into this case, you can think of there is a excessive weakness, there is a sleepiness, and there is a perspiration. So this is the combinations of three things. There is a sleepiness, more excessive weakness, and perspiration. The remedy comes is from the sleep overpowering, dull sleep overpowering, excessive weakness, perspirations, and drowsiness. The remedy is Intimtat. So Intimtat 200 single dose was given, and the miracles happened. The next day of hyperexia, she resumed her school again. So this is what how acute is working within hours of prescription. So this was the last case of this book. Case of 10, a homeopath with the hyperpyrexia. There is a case of hyperpyrexia about 105 Fahrenheit of the homeopath, whose wife, also a homeopath, rang me up saying, "My husband has got fever since 2 days, partially responding to the homeopathic drug. Very peculiarly, my husband goes into peculiar delirious state. As soon as the fever rises, he starts saying a sequence of the words in Marathi, his mother tongue, which does not make sense at all, but is a quite rhyming. After this, he wants all the family members to come and sit around him. He then starts giving lecture and advice to them. The lectures are on the Hanuman's and the homeopathy. He has bored us all since the last 2 days, especially at night. He calls all of us. So this is what the things is. We all family members have not slept at all, but one thing is certain, all family members have received full knowledge of homeopathy. Do something. We all are tired of these lectures on homeopathy is outright chilly and lively. Sir, I have tried belladonna, which relieved him slightly, but now he is worse. So belladonna was given. So again, the assessment. This is what a rhyming. So he makes verses. He is chilling. Talk nothing but one single subject and talks of the homeopathy and Hanuman. This is a science. So the single dose of cannabis indica 200 was given and first increased the fever slightly and then cured him with the sense of well-being. So this is what how the beautifully sir has used this chart in the case taking, and this is what we are dealing with. So these are the few cases, and now the inconclusive conclusions of this book is that after having gone through this book, many eyebrow will be raised. The skeptics and critics will have a field a day, for I have given them food for thought. The mixture prescribed and the single remedy similar prescriber both may disagree with the pattern forwarded by me of activity thermal burst mental axis. But then I have found this axis covering the holistic concept. The remedy thus evolve as a representative of one of each of the constitutions that man is made up of. The man as well as all know is a part of universe and is made up of the five essential elements of the Panch Tattva, which is accepted by the Hindus, Chinese, Buddhists, Judaism, and Mohammedans alike. These five elements are the fire, water, air, earth, and ether. So this is what how the whole man is represented in the activity thermal thrust chart. So ether represents the cosmic energy which is all pervading and which control the activity of this universe as well as the activity of the man. The activity thermal thrust axis base simillimum is true representative of the holistic man. Since the activity represents the ether, the thermal, it means the heat regulatory mechanism of the body represents fire. The thirst, which is control, the osmolarity, it represents water content of the body, represent the water. This covers the three of the five essential elements which each human being is made up of. To this, we add either the symptoms of the air, which we call as the mind, and the earth, which we call as the physical body. This covers the man as a whole, so the drug prescribed has a representative from each of the element and hence work holistically to give miraculous cure in an incurable or advanced or a serious cases with a minimum effort. Above all, the Harring's law of cure can also be observed in such cures. So we all discuss more about it in my forthcoming book, The Theory of Chronic Disease, Homeopathy is Easy, Homeopathy is Mathematics. So this is what the conclusion made by the sir in this, and the few chapter of this, the remedy relationship. So whenever you have a chronic remedy in your handy and the patient comes to you in acute conditions and you have this remedy relationship chart, so this will help you to prescribe a certain remedy. So for example, the pulsatilla case, we have seen the patient was pulsatilla, but in acute condition the patient become chilly and the remedy prescribed is silica. So this is the applications of the above chart in the practice. So you can go through this chart. I'm not going to read that chart again. Again, understanding of the chili and hot remedy. So it is very easy. Sir has made this chart that all acids are chili except the chloric acid, carbolic and picric acids, alumina chili, arsenic chili. But the element of arsenic like arsiod, arsmat is hot. Antimony can be both chili or hot, but antimtart is chili. Argentum mat is chili. Argentum nitricum is hot. Barretta, all Barretta are chili except Barretta carb, Barretta iode and Barretta mure. Barretta carb is chili. Even Barretta carb mure can be chili and hot also. All calcarea are chili except calcarea sulf, calcarea iode and calcarea mure. All carbons are chili except carbovage. Cuprums are chili. Kalis are chili except kali sulf and kali brom. Even kali iode can be hot. All mercury can be ambithermal, either in chili or in hot also. So it can be ambithermal. Magnesium is chili except magnesium mure. Natrum is chili except natrum pure, natrum iode, and sometimes natrum carb can be hot also, as it is aggravation by the sun. So metal can be cuprum, mercury, plumbum, stannum are the chili, arsenic matte, mercury, platina can be hot also. Snakes are Nasa and Ilex are chili, Lachesis and Proteus are the hot. Spiders, Tarantula cubensis and Hispanica is hot. Tarantula hispanica can be chili also. Theridion and Myvilia are chili. So these are the few handy tips of understanding that the major polycrest like aurum,
મને
arsenic,
પરોઠો ન કરો
calcarea,
માને જ કરીશ બહુ જ સમજાયું.
major polycrest like aurum, arsenic, calcarea, hepar, maxomica, phosphorus, not phosphorus, soranum, muskox, silica, sepia, param, ignatia, step are the chili remedies, whereas the aurum iode, lycopodium, lacasis, arsenic iode, param. Whenever you think of iodine content, it is a hot remedy. Pulsatilla. Phosphorus can be hot in chronic condition, phosphorus can be chilly. In acute conditions also, so phosphorus can be both. So we have a two type of phosphorus. One is called as red phosphorus and one is called as yellow phosphorus. Yellow phosphorus is chilly, red phosphorus is hot. So this is what the understanding from the source. So this was again the thirsty and thirstless. So you can go through this chart and you can remember easy way that all acids are thirstless except certain acids which are thirsty. So according to that, you can make it out for your easy understanding. And this is very important. The last chapter of this, last page of this book is a diligent remedy. So we have a few remedy diligence, the chili, aurum, aurum ars, baryta, cap, cuprum, ferrum. So these are, there are the metals are mostly chili and diligence, natrums or chili and diligence, silicia, chili, stiffy, pest acid, phos, rust of in a hot, there is a metal with the iode component, the aurum iode, so ferrum iode, iodine, lycopodium is hot, sulfur, diligent, thuja, diligent, baryta, mure is diligent, brahmia, diligent, apis is diligent because of so industrious nature. And by general understanding of non-diligence, all ammoniums are non-diligence, all magnesiums are non-diligence, all kalis are non-diligence. Natrum mure from the natrum group is non-diligent. All acids are non-diligent except acid phos. So there are the exceptions. All snakes and spiders are non-diligent. A revolting drug like mercury, argentum, nitricum, causticum are the non-diligent. Or a liar or a deceitful drug like opium, lacasis, veratrum, hyos, madorina, fluoric acid, tarantula are the non-diligent remedy. So this is what the basic hints and the practical part of this book. Tomorrow there is a holiday as I am traveling to somewhere else, so that there is no lecture tomorrow. We will continue on the Saturday, and we are starting with how to assess, how to ask the questions in acute and how what to observe according to the activity, and then we will start with the materia medica part of the acute remedy. So that will help you to understand the chart in a proper sense. So tomorrow there is no lecture, there is a holiday, and then on the Saturday, we'll start with the questions, what to see in the conditions. So this was the glimpse of this Saturday lecture. So you need to find out the activity, thermal, thirst, axis, plus diligent, non-diligent, plus any PQRS of the patient and the change dispositions in acute conditions. Whenever you got these things, then and then you will get masters in acute conditions. So we will continue this on the Saturday, as I am traveling tomorrow, so there is no lectures tomorrow. So thank you so much. We conclude the day today. Thank you all. Thank you so much.